G'day folks, and welcome back to part 2 of this conversation with Sam Conaway, an inspirational leader and change maker who is working to bring new cardiac technologies to physicians while also improving access, representation, and patient outcomes. In this episode, we'll go a little further into his work on Close the Gap and dig into the lighter side of Sam.
I did it by a strong work ethic, outworking him, working smarter, making sure I was clinically competent, really clinically competent, and making sure that I was in that environment in a way where I was an expert. And that's how I've really done everything since then.
I was going to say, everything up until then and then everything since then, right?
That's
so that's
right.
how you've got this path.
Yeah.
All right, so what was next?
Yeah. So had, just 3-4 amazing years, took the business to $15 million, which, was for rural Richmond, Virginia, was a lot. And then something happened in my career, which was a stumbling block for me. I had a lot of companies kind of coming after me at that point. And I was thinking about leaving the company because what had been put in my head was, oh my gosh, Sam, you're doing $17, $18 million. No one's ever asked you to be a manager or whatever. And I didn't have my degree. That's one thing that I hadn't been able to focus on because I was so passionate about being the best pacemaker rep in the space. And I was embarrassed by that a bit. I never really talked about it and never let anyone know that I didn't have my degree. And I remember going for this job because they had convinced me. And when I got to the interview, actually flew out there, got to the interview, and the guy said, so where did you go to school? Washington Hospital Center School of Nursing, Cardiac Cath. No, where'd you go to college? I didn't. Well, why are you even here? You can't get this job. You can't work for us without a degree. And I was like, Really?
Look at this accomplishment.
Look at these accomplishments. And so I needed to have that happen because it made me realize that I needed to accomplish some other things. And I went back to school. And I went to not the biggest university. Well, the only thing I could do at that time was the University of Phoenix because I could do it on my own time, at night, on the weekends. And, I'm a big pacemaker rep. Now I'm responsible for a lot of things. I had like 4 clinical specialists working with me. And the bottom line is I worked through that, got my associate's degree, and then Guidant, saw the value and gave me my first regional manager job in the territory that I had built. And so, 5 years later, I have, a $30 million business, got 4 or 5 reps working for me, clinical specialists. And, I ran my own region. I think we took it up to $50-60 million. And that was just a great time. I had my own office, built out my training center and did all these things, that interesting, this other company recruited me to do, but didn't believe in me because I didn't have a college degree.
Yeah, which is, I won't swear again. But that is something that's pretty important to me. I think that degrees are important, but they're not that important.
Yeah. And they don't define people.
No,
right?
Absolutely do not.
And I can tell you, if I went to Harvard, I don't know if I would have the insatiable work ethic that I have. I don't think I would have that insatiable passion to succeed and learn and go up against odds and all those things.
Because you said it like 3 times in that. What's important is learning.
Learning. Not
about a piece of paper. It is about learning. And I do believe that, you can learn in the best schools in the world, or you can learn through, through what your experience is.
That's right.
And I think that, so look, they missed out. So we'll still keep going.
Keep going.
A long way to
go.
I
know.
Right. So from there, so now you're still at Guidant.
Still at Guidant, rocking and rolling, and we became Region of the Year. Those, again, I always tell young people in the business, whatever job you're given, do the best job you can do. And I will tell you, I was the best orderly. I was the best EKG technician, best monitor technician, best CV tech. And I think you have to be the best at everything you do in order to get noticed and achieve things. So, did that with the region, and then got an opportunity to lead at that next level. And the most fascinating thing happened. I get the opportunity to go to run Southeast as an area director, and everyone in the market quit. Medtronic had come in and basically put deals together for the whole group of people. Took the whole sales force. Took it. But I actually went and met with 9 out of 10 individuals, and I convinced 6 out of 10 to come back to the group under my leadership. And I was so proud of that because, you know, I said, you know, I could do 2 things. You know, I could feel sorry for myself, I could get angry, but I said, I'm going to go create a winning environment and let them know that if they come back, that we're going to have what they were thinking they were going to find going to Medtronic. And we reversed that thing, and we didn't lose much revenue, and we built that thing up, and I became AVP of the year, actually my first year, because we really brought that thing back. And it was an amazing time for me, but a big learning experience around people, right? And understanding that empathy and having, you know, listening to people and why they did what they did. I mean, I literally spent 3 or 4 hours with each person just listening and formulating a strategy to get them back. And the value of people, I learned that it's strong. And, you know, having that empathy and passion for them and understanding what they're going through, and then getting them to make another decision at that time, but delivering on what I had promised, right? And, you know, those people, we're friends today.
I was going to ask you, so were you able to deliver on those promises?
Absolutely.
Sounds the answer is yes.
Absolutely.
All right, so let's keep going
keep going down the
chain. What's next?
That's right. So what's next is I had a chance to step out of my comfort zone, and we did that a lot at Guidant. They would, for future leaders, I was, you know, learning about leadership at a deeper level, a more, you know, academic level. And I had a chance to step out of my comfort zone and go into HR. And it was an interesting time because we were growing so fast. And the first thing that we had to do was hire 500 people as fast as we can. I put our strategy together to go out and hire 5 people to come into the Guidant organization at that time. And it was one of the greatest experiences that I ever had, making that happen. You know, learning about how to get, you know, the organization behind you, the different constituents, finance, you know, HR, you know, training, getting all that stuff together, building a coalition of believers. I learned about change, leadership, and management. And we built an amazing company that grew like crazy.
And then
it happened again.
Then it happened.
It happened. So I never forget, we learned that J&J was going to buy Guidant. And I was on the leadership team, the transition team. Literally for an entire year, we would go to Chicago every week, and we were putting together this transition into J&J. And then actually at TCT, can't remember the exact year, but we had an issue with our defibrillators. And J&J had come back and said, hey, listen, we're not going to pay $27 billion for this company. We're going to pay $18 billion. And the leadership at Guidant said, no, we're not doing that. And that whole deal broke apart. And then it was a very interesting time because you didn't know what was happening. You know, we knew that the organization was in a little challenging time because of the defibrillator issue. We were having recalls left and right. I mean, I was on the phone call every week, almost felt like telling my organization that we're going to go through another recall. And we had to downsize the organization because we were losing revenue. And it was a lot of challenges, right? A lot of change leadership going on. And then in the middle of the night over the holidays, Boston Scientific comes in, makes the announcement that they're going to pay the $27 billion. And as you know, they didn't have all the funds. They had to bring in another team member, which was Abbott. And Abbott gave them the $9 billion to complete the deal. And then we had to divest some of the things because of, you know, FTC and monopoly, particularly in the vascular side of the business, because Guidant had a strong vascular business, Boston Scientific had a strong vascular business, and we actually split split the leadership up. And this was a changing and an interesting time in my life because I was sent to Abbott. I wanted to be with my Boston friends. I grew up in cardiac pacing with them and literally found myself over on the other team. That was a challenge.
For a little while.
For approximately 6 years.
Yeah.
Until I could get back to the team I wanted to get back to.
Over COVID, is it really true that you got yourself an MBA?
Yes.
Well, tell me about that.
You know,
both of you?
Both,
is that right?
My wife and I.
Yeah.
Who's a brilliant person who actually grew up in the Bay Area here. Went to Santa Clara University. Wonderful. Shout out to my wife, Desiree.
There you go.
I had promised my parents, and unfortunately they both died fairly young. My father at 62 and my mother at 70. And that was devastating for me because both of them, you know, I couldn't do anything for them. They had cancer, and here I am in the business and couldn't do anything. But I promised them that I would get my bachelor's, and promised them that I didn't really promise them I would get my MBA, but I wanted to do more because it took me a long time to get my bachelor's. And so my wife and I were sitting around, we're like, hey, we're home. We want to do, you've always talked about this MBA, you want to get it. And a piece of me was also feeling like a bit of an imposter syndrome because when I looked at all my peers who were at my level, they all had MBAs. Sure. And so we said, hey, you know, there's a way to do this. There's a, you know, online program. We have to apply to them, whatever. We'll get in one of them, I'm sure. And I got into the University of Maryland, which is in my hometown. Yep. And so we worked our butts off during COVID. It was tough. The weekends, we just worked and studied and, supported each other. And either one of my best friend's colleagues also did it, Dave Passetti. He also did it with us because I called him up and said, I'm doing this.
When did you call me up? I spent the time watching Netflix.
Yeah, so we all three did it, and it was a wonderful experience. Yeah, so we got that one done.
All right, well done.
Yeah.
All right, so the next one, which is we've spoken in the past, and I know it's something that's that you are passionate about, inequity. Inequity across the board, but inequity in healthcare.
That's right.
What are you doing about that?
So, we started a health equity program with Guidant 20 years ago, believe it or not. And it was the work of some very bright people, Camille Chang Gilmore, who's actually with us today, still in the role of D&I for Vice President of Boston Scientific. And also she helps me with Close the Gap. But the way we started this was we noticed that there weren't a lot of Black people on the table getting pacemakers and defibrillators.
On the table.
On the table.
Yep.
And I'm like, why is this? And we realized that there was a disparity in care. And so we formed an affinity group to get after this within the Guidant Corporation. And I'll never forget, we had our leader, Ginger Graham, at the time. We went to her and say, listen, we want to do something to give back. We want to focus on this underserved patient population for implantable devices. And she was like, whoa, this is a daunting task. I don't know about this. There's a lot of reasons. There's a Tuskegee project that turned off African Americans from getting devices. There's mistrust in the physician community from African American patients, people of color, from women. There is, a issue with insurance and institutional racism and all biases and unconscious biases. Boy, it's just so many things happening that this is a daunting task. And we said, nope, we want to do it. And so the first thing we did was we interviewed patients, we interviewed physicians, and we learned early on that you have to speak to people of color differently than you do white males about these devices. If you get too technical, they'll turn you off like that. And so really has been my life's work, because when I went away from Boston Scientific, who actually assumed that from Guidant during the acquisition, Camille and all that group continued on with that work. And when I came back, they made me chairman of Close the Gap. And now, 10 years later, I've been with Boston 10 years later, we have transformed this into real action where we are partnering with hospitals all over the U.S., building programs to tackle this health inequity. We have community events. We're waking up the community, making people realize that the number one killer of all people is heart disease. We're doing clinical trials where we are actually getting enrollment at high levels into clinical trials where African Americans typically represent 2% or women represent a small percentage of clinical trials. And I always said that, can you imagine if you talk to a patient and you said, we just finished this clinical trial with this particular device and 40% of the people that look like you were in that trial and it turned out positive. Would that make impact on you to do these devices? And so this work is just amazing work, and we're doing it right now, and we're changing the world. We're influencing how people look at people of color differently to get them care. In all of the hospitals that I'm working with now, they have robust programs to touch that community in a different way to get people health care. And they realize that it is an issue, and I love the physician community. When they see something as an opportunity, they typically jump on it, and no one has ever been malicious enough to say, I'm not going to serve a patient. It's just a bunch of things that cause it.
Yeah, I want to touch on that in a second, but go back. So this is now, got to give Boston tremendous credit.
Yes.
But it's now bigger, right? It's beyond just Boston Scientific now.
Yes. Yeah. It is. And, Close the Gap, I think, has taught a lot of people that you can do this. And I just remember going back to my old leaders and like, wow, this is a daunting task. But now all the companies are jumping in, which I love. Edwards is doing a trial. Shockwave is doing a trial. But I feel like, Boston Scientific certainly led the way. And I love that my colleagues are actually jumping in. We have partnered with all the societies, with the Association of Black Cardiologists. We're doing trials now. The FDA's jumped in and saying, listen, you have to have a diversity strategy. You have to have a strategy to get more diverse patients in your clinical trials. And they've even gone so far to say that you can't put in your IFU that you served all patients unless you have served all patients in your clinical trial. And I am so proud that, all these things are really emerging now, and health equity is on the podium and is a big part of what everyone's doing.
It's a big part of our Innovation Day that's coming up with the partnership we have with TCT, or CRF, at TCT.
Yes.
So where we're going to end the day is on equity.
Equity, yeah.
And just give us an example. You and I, when we were walking in here, we had a conversation about Medicare. So there's something I didn't know. Tell us that.
Yeah. And this is interesting. You use the word innovation and Close the Gap, because I do believe we're in an innovative period now around health equity. And we are going to be doing things so different than we've done before to get after this thing. And it needs innovation, and it needs people like yourself and CRF engaged in a different way, right? And so one of the things that we had a forum recently, and we were talking about how people of color, particularly people of color who have Medicaid, don't stand a chance in terms of getting some of these innovative devices, because a lot of them may have Medicaid, and Medicaid doesn't cover, right? So TAVR, Watchman, some of these newer technologies, and actually innovation itself could cause a bigger gap, with some of these new therapies. And so we were talking about how important it is for CMS to realize this, and the government to realize that when these innovations come out, there has to be a across-the-board way for patients and people of color and people of maybe not capable of getting the Medicare or private insurance. They have to get the care also.
Yeah, so unintended consequences.
Unintended consequences.
Yeah, and I think this is when we talk about the inherent bias or
And unfortunately, this unconscious bias thing is something that people don't realize. And when I give talks about this, I get very, very passionate about it. And I say, listen, I am not here to discredit anyone. I mean, we all have unconscious bias. I have it.
That was the word I was looking for. I'm sorry. Thank you for helping me. Hey, so I happened to be there last year when you got the Pulse Setter Award and CRF. Tell me how your acceptance speech, like brought tears. I was very proud of you. How was that? That's recognition for a lot of tremendous amount of work.
I never thought I would get anything like that.
Think about how full circle, right?
But it's this full circle you're talking about. I can when I was Juan called me and Marty called me and said, "Listen, we want to talk to you, and we're going to be giving out this award, and we want you're going to be one of the awardees." And I literally, weak, like really me? Why me? And you have that why me thing, and you start reflecting on it. I'm like, man, I remember the days of being in that laundry room, being that monitor tech, working triple shifts, doing calls, saving lives, doing all these, things that I never thought I would do. And to get recognized for it was just absolutely, and to get recognized by one of your mentors, Marty Leon, is even more amazing because when I was coming up, Marty used to bring me into his office and he was filling my mind with dreams all the time. You can do this. We did courses together when I was with DVI, East Meets West with Paul Tierstein, and we were doing clinical trials, caveat, boat, and oars. These were ideas that this icon was sharing with me and giving me his time, like I was, a big to do or something, and that was amazing. That was most. Other than having babies and getting married, that was, one of the most amazing nights of my life.
Yeah, it was a beautiful night.
Yeah.
The impact there, this is something that we always pick up on, right? Which is that Fogarty, the whole point is about mentoring. It's something that Tom has always. Are you returning that favor?
Yeah, so a lot. We've started many things. Well, I'll start with my kids. My kids are special people, and I felt like I've been a mentoring father, sharing and giving as much as I can to make sure that they have a great life. My nieces and nephews, for instance, when you go to college in the Conaway family, from Desiree and Sam, you get $100 a month in your bank account for extra things you need to do. Mentoring young people coming up in this space is something I love. We started a program at Boston Scientific called Boost, where people who are outside of the industry, we have mentoring calls with them. My team is mentoring them to bring them into the medical device industry. We started a program at Boston Scientific called BSC. This is where we're helping women develop entrepreneurial leadership skills, and we're promoting them at a rate that I know no other company is doing that. We have a bunch of infinity groups like Bridge, which is something in the organization that helps foster diversity and getting people into leadership positions. I have 20 people that I talk to on a regular basis for an hour, 45 minutes on helping them develop their career. I will tell you right now, you can ask anyone, if I see your name in LinkedIn and I look at your resume and I think you've done a good job, I call you and say, hey, give me a call. I do that for all people and try to get them into the company, and because it's all about creating this amazing culture at the company. It's all about the people. And so I love doing that, and I do a lot of it, and it's so gratifying.
Leads into work-life balance. I think I've changed my mind on that now, work-life blend. Yeah. How have you managed?
Yeah. Very challenging piece of my life. If I could do something over, I would have been there more for my boys than I was, because I was traveling and trying to make my mark in the space, and taking call, and I missed a lot of things and all that. And, I think it's taught them a lot around work ethic and passion for what you're doing and all that. So that early part of my life, I would say, the mid part of my life probably didn't do that good of a job as well, because, my first marriage didn't work out. A lot of it was competing with my work, and I was young, didn't understand it, thought, boy, you have a house, you have a car, you have food on the table. Why aren't you digging this? She wanted me, right? So that didn't work out. I learned that lesson, Now in my current marriage, I make sure that I spend that quality time with my wife, and I make sure that I come home on Friday and I'm not going to every conference. I make sure that she's integrated into my life. So it's very common that you'll see Desiree at a conference.
Yep,
or
I
at
have.
a meeting. You have, yeah. And so definitely better. And I like that word you use because it really is integrating your work and your business. And I think you can do that and make everyone appreciate it, but be inspired by it and enjoy it. And so that's what I've been done differently than I've done in the past.
Yeah, that's an important lesson, and that's part of what we're trying to communicate with this. We've heard that you were always a meticulous dresser yourself. Always. Is that true? Yeah, and then I'm going to continue on, right? So hold that.
Okay.
But clearly you've been influential on others. How are you responsible for transforming the interventional cardiology world to be more fashionable? Is that true?
So I'll take it from when I was young. I had a uncle named Samuel Lorenzo Conaway. Actually has the same initials. My name is Samuel LeBron Conaway. And I used to watch this man. He always had a hat on. He always had his haberdashery. He was always clean. He was a laborer. He worked in like Bethlehem steel, you know, but his nails were always done. We used to see Uncle Lorenzo. He was impeccable dressed. You would have thought he was the president of the United States. And I just admired him. And my father loved haberdashery and loved dressing as well. And so I never forget this. I am getting to know Marty, and he's on the podium a lot. And I'm like, hey, Marty, we need to go shopping, bro. You're big time now. You're not the NIH anymore. You know, let's go shopping. And I never forget, I took Marty on his first shopping spree and got him outfitted in Hugo Boss. And it was a great time just doing that together. But that's where I think I got my reputation, and then it permeated all through the medical device industry.
Not surprised.
Yeah.
The fact that you called it haberdashery gives you
a little credit. That's right. Yeah.
Right. Maybe you can take me out. I'm sitting here in blue jeans. All right. So, what are you passionate about today? You know, what gets you going today?
Yeah. Getting me going today is giving back. I mean, I feel like I have had such a blessed life. And someone asks, well, aren't you retired? What do you mean retired? I mean, I don't think people like us retired. Yeah,
you're a little young.
Yeah, I'm a little young, but why would I do that?
Yeah.
You know, I'm just getting competent and good at what I'm doing, right? And this conscious competence is a big thing that I believe in, you know, and conscious competence means that you actually do things because you know what the outcome is going to be. And because of that, I want to give back and teach and develop and help people get to that next level in leadership, and feel like I can do more for my family than I've ever been able to do. And so it's all about giving back now, and helping people get to that next level, and helping people do things they didn't think they could do, right? Like I was a young man. I never thought I could get to this place. And so that's what I'm all about right now. So I spend a lot of time with that and doing that.
So opportunity to give back now. If you a couple of words of wisdom, and a couple of words of wisdom for the folks listening. Young entrepreneur, young innovator, young tech.
Yeah.
Yeah. What did you learn?
Yeah. You know, I love the word innovation because what innovation to me means is basically developing yourself or developing something or skill sets and things like that, right? And I think I would tell young people, work on yourself, invest in yourself, develop skills, and be very conscious about it. Like if I were to if I had written down everything that became a pattern in my life, I think I retained a lot of it because I repeat it, but I would say write those things down so that you know it worked. You know it worked twice, you know it worked 3 times, it probably worked a 4th time, a 5th time, and repeat that, and you'll have a lot of success. Big on do your job. Stop thinking about what you could be doing. Do the job you have today.
But this is what you said at the beginning, and I was going to use this as the last line, so we won't, but it was, you said before, do your job the best you can.
That's right.
And it's do the current job
the
best you can. Not be
Yeah, don't be looking down the road or wondering why you weren't, given this opportunity before. Is do that current job the best you can, because if you do the current job the best you can, then you get the opportunity. And, you know, I was speaking to a young person today, and I said, you know, it's interesting. I have never asked for a job or a promotion. People have always sought me out and said, hey, you're doing this job, you're ready for the next job.
Yep.
And I take pride in that, but also I know it's because I did that previous job well. And so I would say third, do the job. And then I think finally, and this is very important because you can get sidetracked or you could get derailed. Don't do anything you don't want to see in the Wall Street Journal or in the newspaper. Ethical standards, high standards for yourself and how you conduct business is critical.
Yep.
And I've seen a lot of people go down doing the wrong things. So that is very important as well. And that's what I would say to people.
Beautiful. Let's leave it at that.
Okay.
Thank you very much. Thank you.
That was wonderful.
Thank you for joining us on MedTech Trailblazers. We hope you enjoy learning new things about another impact maker in our industry. Do join me again for future episodes in this series by subscribing to this podcast. Please also like and share our content with your colleagues. We want to hear back from you with names of MedTech leaders you believe are trailblazers and whom we should consider having on this show. Until next time, I'll leave you with my usual parting thought from Hannibal of Carthage that should resonate with all of us trying to make a difference for patients worldwide. And that is, I will either find a way or make one. Cheers.